Hey, good morning, Doc.
Morning, Magda. Thanks for coming back. We talked yesterday about how we had to break the news to you that you had tested positive for the herd mentality disease. It's an airborne disease. It's in the air. It's everywhere. Everybody's picking it up, it seems. So we're seeing a lot of this. And I mentioned to you that we're going to have a little therapy for you to combat this disease. You'll be okay if you follow our therapy, but let's understand the disease a little bit more. Remember, it's called herd mentality. All right? Now, the herd mentality, the characteristic is, it's a fear-based thinking, especially about the coronavirus. It's faith versus fear. So we live more by fear and less by faith. Almost not at all by faith. Faith starts to become very, very diminished, very non-essential. And the fear is what eventually rules us. The second characteristic is, it's called an all or nothing. For example, we might say that coming to a place like this, if you come to church, public places where people gather, that there's a risk for exposure to disease. Yes, there is. However, because of the fear-based aspect of this disease, people are now thinking that you will get sick. You will get sick when you come to church. It's automatic. So you stay away from church, or you wear your mask, or you have to do some kind of big-time social distancing. Some churches aren't even allowed to open up because they're considered so dangerous. So you see, it's all or nothing. It's like from going from you could get exposed to you will, be careful, watch out, stay away, it's dangerous. All or nothing. The next one is statistics are given without any context. For instance, we hear how many more coronavirus cases are that day or how many deaths. But there's no comparison to anything else. There's no point of reference to anything else. There's no context. All you hear is that number. And so again, that always brings you back to fear. So always remember, the herd mentality, especially in relation to the pandemic, is fear-based. That's the home base. Fear, 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 which is the opposite of faith. Then we have the false gods, such as these things. As long as everybody's wearing these 24/7, we're all safe. There's no more virus. I won't infect you, you won't infect me. So you better wear this because this is the answer. This is foolproof. False god. Another false god is this hope for a vaccine. This miracle vaccine is going to drop out of the sky. Suddenly everything is fine. We'll go back to how we were and it's going to be wonderful and perfect. False gods. And finally, mistrust. We are made in the image and likeness of God. This is certainly something we preach here at this Real Health Clinic. We're made in the image and likeness of God. That's how we should see each other at all times, first and foremost. Unfortunately now, the way we look at one another is, you are a threat to me. You're a possible infection for me. I am for you, but more importantly, it's how you are for me. So all we look around at each other, we're all looking at each other as nothing but walking, talking, mask-wearing potential threats to our earthly survival. So we go from the image and likeness of God to a threat. You see, those are the characteristics of the herd mentality. And again, it all comes back to this, the fear. So here's what I want you to do, Magda. I'm going to put you in a therapy program. I want you to come here to the Real Clinic during the week. You see, like right now, there's nobody here. There's fresh air. You come in just by yourself. You can wear your mask and just pray for a few minutes. Then go home. Come back the second day. Do the same thing. Remember, nobody's here. It's safe. Do it the third day. Only take off your mask. Then I want you to come for a weekday liturgy, like we have Thursday night or Saturday morning. Not many people here, so there's a lot of distancing. I want you to do that. You can wear the mask. You can wear the mask. Then I want you to do it again next week. Take off the mask. And let me know how you're feeling. Let me know how things are going. Then we'll take it to the next step.
Doc, I think I can try that. Thanks so much.